Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
We are absolutely at capacity.
Hospitals battle to maintain patient care.
Am I ever going to get up out of this bed? Am I ever going to walk out of here?
One man's cautionary tale about his life and death battle with the coronavirus.
From anxiety to anger to back to anxiety.
The stress many teachers are facing as they prepare to head back to the classroom.
If they don't make room at the table for you, you make room at the table for yourself.
A powerful voice for youth living with disabilities. Hi everyone, I'm Natasha Williams.
And I'm Andre Moreau. Much more on those top stories in a moment on this week's edition of SWI. But first, the state's latest coronavirus number.
A 3-day drop in the number of cases ended Friday. The Louisiana Department of Health reported almost 1,800 new cases, 24 more deaths, and 22 more hospitalizations in its daily update.
Governor John Bel Edwards says Louisiana is again #1 in the country per capita for COVID-19 cases.
In every region of the state, our present positivity is over 10%. That concerns us tremendously. And when we look at the dates that the tests were actually done, that's how we determine our positivity rate. As of July 24th, the positivity rate for the state was 14.34. And as you all know, the standard is you really want that below 10%.
And now a look at other headlines making news across the state. Small businesses hammered by the pandemic who haven't received federal aid began applying for grants up to $15,000 this week. State lawmakers created the federally financed Main Street Recovery Program with a total of $275 million, money which was expected to run out quickly. 11 bar owners filed a lawsuit Wednesday against the governor. They argue his rules of limiting bars to takeout and delivery unlawfully targets one business sector and imposes overly harsh restrictions. The lawsuit names Edwards and Fire Marshal Butch Browning, Chief Enforcement Officer of the virus regulations. It was filed in Lafayette Federal Court. The state yanked the liquor licenses of 4 bars found to be violating the governor's coronavirus restrictions. The penalty is for a week. The suspended permits are at bars in Grand Isle, Lake Charles, Gonzales, and Harvey on the west bank of New Orleans. Entergy profits surged 53% during the second quarter, with increased demand coming from stay-at-home orders that were observed during the pandemic. The New Orleans-based utility has nearly 3 million customers in Louisiana, Arkansas, Texas, and Mississippi. At the same time, Entergy has seen a surge in many of its commercial customers unable to pay bills. David Joseph was confirmed as the state's newest U.S. district judge. He will preside over the Western District of Louisiana. President Donald Trump nominated the former federal prosecutor in November. Senators Kennedy and Cassidy praised the confirmation. Xavier University in New Orleans has received a $20 million donation from Mackenzie Scott, the former wife of Amazon chief Jeff Bezos. It's the largest private contribution in school history and part of hundreds of millions of dollars Scott announced she'd given away. Saints quarterback Drew Brees and his wife Brittany announced a gift of $5 million to build community health centers throughout the state. It's the second $5 million gift given by the Brees family since the coronavirus pandemic began.
Senator Bill Cassidy introduced legislation Thursday calling for the equal economic impact payments for all Americans regardless of age or dependent status.
Now, there have been protests and worry about the end of the $600 unemployment benefits. Negotiations about another stimulus package are stalled now. Cassidy and John Kennedy are among Republicans supporting a benefit of $200 a week on top of state unemployment pay.
We've got to support families. Where we end up is going to be a subject to negotiation, if you will. The stipend continues for at least a while, 2 months, I believe, and potentially 2 months after that. So where we end up has got to be consistent with supporting families through this, and it has to somewhat dovetail with economic recovery. If there's no jobs, it's one thing, but if jobs are recovering, it's another. So to say at a point in time, this is where it should be 6 months from now, is really a difficult statement.
LSU football, if it happens, will look very different. The SEC announced it's going to a conference-only 10-game schedule that will begin September 26th. The SEC championship game has been moved to December 19th.
It apparently means the Tigers will play 2 other SEC teams in addition to the 8 currently scheduled. The season opener would be against Ole Miss in Tiger Stadium. That rematch with Texas won't happen.
Yeah, LSU also says it's going to mobile ticketing, and all concessions will be credit card only, no cash. Coach Ed Orgeron this week gave a virtual address to the Baton Rouge Rotary Club and about the season said this.
I'm going to have our team ready. We're not going to blink, and we're not going to change our mindset. If they move it back, if they change it, who cares? It doesn't matter. You call us at midnight, we'll go play in the pasture.
Dr. Amanda Logue and Dr. Henry Kaufman are 2 of the top health leaders for the multi-parish region of Acadiana. They tell me the hospital system there, because of COVID, is operating at its limit.
Over the last week, we've been in a sort of a plateau, but at the highest volume we've ever seen of COVID.
What is the percentage of your hospital beds that are filled and devoted to COVID patients?
Half of our ICU is filled with patients suffering from COVID, and 1/3 of our floor beds or the non-ICU beds have patients that are suffering from COVID. We have been diverting patients, which means that we can't accept transfers coming into our hospital. We would defer ambulances if the patient is stable enough to find another place to go.
Typically, you would say, yes, of course, welcome, but we've got plenty of room for you.
Yeah, and I have statistics that in July, we turned away 87% of the requests for transfers into our system just in July.
As a physician, that must hurt your heart, right?
Absolutely. It's a good way to put it. Most of these people are from Acadiana, and they may be coming from smaller rural hospitals that need extra care. The last thing we want to do is send people out of the region.
Dr. Kaufman says there has been improvement in overall mask wearing and social distancing, but says evidence suggests a lack of consistency.
There seems to be an attitude where if it's not directly affecting them, people aren't taking it seriously. And unfortunately, there are a lot of people in our community who are being directly affected by it. The other big concern that I have, just as an administrator of the hospital, is our staffing right now. We have a lot of nurses who are getting sick from community spread, and that is having a significant negative impact on our normal operations, on our ability to take care of the patients we have. And also, it's taxing the people who aren't sick, and it's putting them at risk. If the hospitals don't get a little bit of breathing space, that there's not going to be any reasonable pathway toward opening the schools on time either. And that's going to have a huge impact on our community. Every individual's action in this community has an impact on everybody else. We are all one in this community. We need to act with a common mind, a common goal, and a common purpose if we're going to achieve our common goal, which is suppressing this virus to the point where we can open up full economic activities and enjoy the personal activities that we all want to at this point. Unfortunately, I think there's been too much of an attitude of, well, it's really not as bad as they're saying, and this whole thing has been politicized, and it's been, there's definitely been a political spin to it, but regardless of that fact, the pandemic is a very, very real event, and it's having a very real impact on the hospitals and the community.
Until this day, Kenneth Grant has no idea how he got the coronavirus. His business was shuttered as a part of pandemic protocol in mid-March. He quarantined and followed strict hand washing and social distancing. He still got it, and he says it was the battle of his life to survive. For more than 45 of his 65 years, Kenneth Grant has made making others look good his #1 priority. Some of his high-profile clients include Grammy Award winner Jennifer Holliday and gospel great Yolanda Adams. The New Orleans native opened his hair salon in Baton Rouge shortly after Hurricane Katrina, and many of his clients have been relying on him for decades. But in early April, Grant's very structured, organized life spun out of his control, a victim of the coronavirus.
They shut down our work March 18th. I started feeling some symptoms like flu-like symptoms, and I had a persistent cough over the days that we were quarantined at home. I called my doctor, say on March 26th or something like that, and she suggested that I have the test done, and it was 3 or 4 days later before I got the results, and she said, you tested positive. But by the time I tested positive, I had no temperature or anything like that. So at that point, you couldn't go to the hospital unless you had a temperature. So as the days went on from that Sunday to that Wednesday, I started progressively feeling worse, nauseous, headachy, just feeling like the flu. And she had prescribed, I think it was Levaquin, and I was taking that, and the cough was persistent. I couldn't walk from my bedroom to the bathroom without almost falling down on the floor because I couldn't get any air. I even walked to my front door and opened the front door thinking I could get some gulps of fresh air and stuff like that. Nothing was working. That's when I started to panic, and I was like, I can't breathe. As I was just laying on the sofa, I couldn't move. I was like, if this is it, God, I'm sorry for whatever I've done. If this is it, because I don't think I can come out of this.
And from there, he went downhill even faster.
I felt really that I was dying, which is something that is very hard to describe to people because everybody's experience is different, but I really felt like I was struggling to breathe, and I dialed 911. I was able to make it to the front door, and they came in, they started administering oxygen. The lady told me, she said, we have to get you to the hospital right now.
And Grant says once he got to the hospital, it really started to sink in.
It was very chilling and very realistic, and in spite of how I felt, the lady said to me, she said, do you have all of the things that you need? She said, because no one can come in with you and you can't leave until we arrest the virus. And it was really terrifying.
He says the hospital staff took excellent care of him, but
I was still alone. I was still not feeling well at all. It felt as if someone was sitting on my chest. I couldn't breathe. They put me up with a lot of different oxygen tubes and a lot of IVs and taking a lot of blood. My main concern was I didn't want to be put on a ventilator. I'd heard so many stories about the ventilators, and I was very, very anxious about that. I had high anxiety. And also, with my fever was 104, so I was hallucinating a lot. You know, you're dreaming about when you were a kid, and you know, it's just crazy stuff. And I kept telling the man, I can't sleep. He said, as we bring it down, you're gonna rest better.
It would be day after day of restlessness, pain, and uncertainty all around him.
It's a feeling that I've never had. I wouldn't wish it on anyone. I felt so weak and just decimated, laying in the bed. Holding up my head was a chore. They would, make me sit up and things like that to try to get me to breathe more. I had the oxygen in my nose, and then I had another one on top of my face, and they put a mask on my face as well. And so it was just so cumbersome. I couldn't eat anything. Nothing tasted like anything. Everything was very, very bitter and very sour tasting. I felt, and I'm sure a lot of people who've experienced it felt this way, that am I ever gonna get up out of this bed? Am I ever gonna walk out of here? And all through the night, you hear code red, code black, code blue. Someone was in more distress than me. And I really began to develop a grateful heart that I said, at least I'm conscious, at least I'm here. I don't know what the end's gonna be. My body was very, 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 very weak. And I started losing weight. I think I lost 13 pounds.
It would be about day 15 before Grant turned the corner, leaving Our Lady of the Lake Medical Center for a step-down coronavirus care facility at Baton Rouge General. His fight not over, but a visible light at the end of the tunnel. He says point blank, take this pandemic serious.
My PSA announcement to anybody that's listening or watching this this program is that this is something that you don't want, that it is not geared to one type of person. It can be anybody, and everybody's results are different and everybody's response is different. So I say put the mask on at all times. Don't ever waver in that. Don't get lax. There have been times recently where I jump out the car and I say, oh, nope, go back, put your mask on, and things like that. Treat yourself with care. Wash your hands, use the sanitizers, use Lysol, whatever sprays disinfectant you have. When I walk into my house every day, I spray it. I'm the only one that lives here, but I still spray it because I know I'm coming inside with something. I'm wiping my door handles and stuff. And it's not a paranoia thing at all. It's not taking your rights away. It's merely, I want to live to see my grandchildren grow older.
Grant's high blood pressure likely made him at risk. He says although he no longer has the virus, he has some lingering issues like problems with his vision that his doctor believes could be a result of having the illness. Louisiana schools were scheduled to open their doors to students in about 2 weeks, but after protests led by teachers and several teacher organizations, the date has been pushed back till at least Labor Day. But will they be ready even then? We talked to a teacher and union official who tell us they don't really think so. Social studies teacher and newly minted social and emotional learning coordinator Ciara Hart is preparing to return to the classroom at Kenilworth Middle School in Baton Rouge. But she, like other teachers around the state, have very mixed emotions.
I feel like I've been going through cycles, and it spins from this very high anxiety to an anger around going back, solely because we don't know what we're going into, and we're not getting the support to even be able to properly navigate those emotions.
Those emotions spilled over on July 22nd as teachers protested in front of the East Baton Rouge Parish School Board office, signs spelling out they do not feel safe returning to school in August. They got their wish. In-person classes have been pushed back until at least Labor Day. But will it be safe to go back even then? Hart says she can't help but worry.
It's daunting because we're risking our lives, whether people want to openly admit that or not. We're ultimately risking our lives to be able to educate kids.
She says nearly everything they do must be changed.
I think about it as simple as the culture building that I do in my classroom. It involves hugs, dap, handshake. That is how I initially set the culture and relationship building in my classroom. I won't be able to do that once we return to this hybrid model, because it's not if, it's really when. Just because for school systems, it's not feasible for them to do online learning because they haven't done the full-out planning of what online learning looks like.
She says in her new position, she's supposed to lead in situations like this, but it's difficult to imagine herself or her coworkers being comfortable in their classrooms in a matter of weeks without a protocol that can't possibly be put in place to address all the potential what-ifs.
I really don't think that will happen until we have more information and resources from leadership. And that's really what we've seen a lot of lacking. I can give them all the self-care tools in the world, but it ultimately doesn't, take away from the reality of what we're going into. So it's these temporary fixes that I can give to say, okay, here are ways you can manage your anxiety. Here are things that we can do to be as prepared as possible. But when it comes to walking to the building and risking our health, there's only decisions that can be made from those who are in charge that will really make us feel better.
And veteran teacher and president of the East Baton Rouge Parish Association of Educators, board member of the Louisiana Association of Educators, and executive board member of the Louisiana Association of Educators, Anita Augustus, agrees.
Our concern is that our children need to be safe. We want them back in the classrooms as educators, but we want them to be safe in the classrooms. And because we're noticing in other states that the numbers are rising for children, and in the beginning, the numbers were the directive was that children wouldn't get COVID. Well, we know that's not true, because in Texas, there were 85 children in the last count that we had that were under the age of 2 that tested positive for COVID. In Florida, over 7,500 children tested positive for COVID. Our concern is that these numbers are there, and because we've not tested children historically, that will, once they return to school, that we will see numbers increase in the adults around them, not only to the educators, but also to the families at home.
Augustus stood with other educators as a leader of the recent protest, hoping their stand will ultimately keep everyone as safe as possible.
We want our concerns to be heard because we want the parents to know that we support them. We know that they want their children back in the classroom, and we want them back in the classroom also. We understand the hardships for a single mom who's working and trying to navigate. We understand that there's one device in the home or maybe 0 devices, but we want them to return safely. One child dying from COVID because we returned to the classroom is one child too many. One adult, bus driver, cafeteria, teacher, whatever the capacity that they're in, we want them to be safe. And that's our goal.
Hart says maybe teachers could be given hazard pay. That would at least be recognition of the difficult and potentially dangerous situation they are facing.
Now I want to introduce you to Lillian DeJean. She's one of our 2020 LPB Louisiana Young Heroes. She just graduated from high school, homeschooled, and next is going to college online at Nicholls State. She has a myriad of illnesses that could keep her from a full, active life, but clearly doesn't.
I have an unspecified mitochondrial disorder and an unspecified autoimmune condition.
18-year-old Lillian DeJean of Lafayette has taken all of what is unspecified about her, those disorders and physical conditions, and pushed past them to become a young woman profoundly defined, resolute, and with a powerful voice for those living with disabilities.
I find a lot of people have expectations of me based on my limitations and based on what my body can and cannot do. And that tends to be more of a hindrance than my actual disability, because I do need accommodations and I do need more rest and I do need these more equipment, but you just go on. Because if I don't go on, I lay around all sad and sick, and no one likes a sad and sick kid laying around.
At 15, she became the first minor ever appointed by any governor to serve as an advocate on the Louisiana Developmental Disabilities Council.
It's really cool to be on the council, and I'm a huge asset to the council because there hasn't been that youth perspective there. And so to be able to represent that perspective is so important because we have different needs and different wants and different goals, and we're in a different phase of life than the adults. And so it's been really neat to be able to find my voice there and find my place and carve out a place that's never really been carved out before.
Lillian's mom, Nicole, says her daughter is not to be underestimated.
You really have to step back and really kind of review your bias and your perspective and your assumptions of people with disabilities. Again, when you make the assumption about Lillian or anyone else that you may see, and you assume disability or you assume lower standards or you set almost lower expectations for that interaction with them, she's one that disproves all of that.
Take a look at these pictures. Here on a machine measuring the strength of her lungs. This one is syringes and feeding tube meds. And here, Time Magazine and CNN interview her as she visited the nation's capital, where she protested against the repeal and replacement of Medicaid. To see that smile and hear her, then to know all she deals with, I couldn't help but be amazed. So she can breathe and get enough oxygen, for example, she's needed a ventilator for the past 5 years. It's right there in her bedroom.
Here, I can show you.
Yeah.
I can give you a tour.
I'd love a tour. I would love a tour. This is what we've heard so much about during COVID.
Yeah, and I can just power it on.
And so you use that when you go to sleep, or?
So overnight and also intermittently throughout the day. There's been periods of my life where I was on it 24/7.
Her use of a feeding tube gave way to a business idea.
So there's these things called tubey pads, and they're a replacement for gauze around a feeding tube. They're reusable and a little bit more fashionable. And so I noticed for a while that there was a gap in the market So generally, people will create Tubi pads specifically for smaller children. So it'll be like cartoon prints. And so for older Tubis or people with feeding tubes, this wasn't the best because at 18, you don't want to be walking around with a SpongeBob Tubi pad. So I taught myself how to sew with the help of my mom and started a business and started using fabrics that no one else was using. So like I make lace Tubi pads and I make specialty Tubi pads and more geared towards young adults and adults. I come with a lot of whirring noises with all my machines, and I really have to budget my energy because if I push myself too hard, then my organ function declines. To be able to kind of spread the message that, okay, if they don't make room at the table for you, you make room at the table for yourself, because no one else is going to give you that room at the table, especially as a person with a disability.
Lillian has a shop on Etsy. It's called To Be Continued. That's T-U-B-I-E, Continued. Young Heroes is presented with the generous support of the Propane Dealers of Louisiana and additional sponsorship from Hancock Whitney, Community Coffee, Demco, and Hotel Indigo. And everyone, that is our show for this week. LPB wants to make sure Louisianans' voices are heard in the national PBS American Portrait Storytelling Project.
Choose a topic at pbs.org/American Portrait, then submit your video or photo or simply your thoughts. Share your story today.
For everyone here at Louisiana Public Broadcasting, I'm Andre Moreau.
And I'm Natasha Williams. Thanks for watching.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.